Visiting a specialist, especially thinking about seeing a spine surgeon, well, it can honestly feel pretty overwhelming for a lot of people.
Oh, absolutely. There's often some apprehension, maybe even a bit of fear mixed in there.
Yeah, wondering what's going to happen, what they might find.
Oh.
Okay, so let's try and unpack this a bit. Today, we're doing a deep dive into exactly what you can expect during that very first visit to a spine surgeon. We've been looking at some really helpful insights from Dr. Katsevman, a neurosurgeon.
Sure.
And he lays out this clear and actually quite reassuring roadmap for what feels like, a pretty daunting experience for many.
It really does.
So our mission today for you listening is really to demystify this whole thing. We want to give you a clear picture of each step, basically arm you with the knowledge you need so you can walk into that kind of appointment feeling informed, feeling prepared, and not just, completely overwhelmed.
And what's really great, what immediately jumped out from Dr. Katsevman's perspective, is the tone he sets. It's comforting right from the get-go. He really emphasizes that the focus is squarely on personalized, compassionate care.
That's good to hear.
Yeah, and prioritizing your individual goals from the very start. It's not like some medical factory churning out the same plan.
Right, not a conveyor belt.
Exactly. It's about you, your whole situation.
Yeah.
Which is so vital when you're dealing with something as central as your spine.
And that personalized approach, that really starts the moment you walk in, doesn't it?
It has to.
Because the foundation of any good diagnosis, and clearly where Dr. Katsevman starts, is with your story, your unique experience. You're not just immediately sent off for tests. No, it kicks off with a conversation, a really crucial one, where the surgeon actually listens.
Really listens.
Yeah, carefully taking in what you've been going through. It's much more than just a quick, check the box intake form.
Yeah.
It's about getting a deep understanding. And the insights we looked at, they detail the kinds of questions you should expect, all designed to get that full picture of your symptoms. So they'll ask things like, where exactly is the pain? Which sounds basic, but the specifics are key.
Absolutely. Location tells a lot.
And when does it happen? Is it always there or does it flare up? Also, what makes it better? What makes it worse? That's a huge piece of the puzzle.
Critical information, yeah.
And naturally, when did this all begin? Was it sudden like an injury or did it creep up slowly? These aren't just like minor details. They're building the narrative, the foundation for understanding what's wrong.
And connecting this to the bigger picture, well, this detailed symptom history is just paramount. Dr. Katsevman points out it's crucial for, and I'm quoting here, getting to the root of your problem rather than jumping to quick conclusions.
That makes so much sense, like detective work.
Exactly, medical detective work. If they don't understand the timeline, the triggers, the exact feel of your pain, then any tests they order later might, they might miss the mark.
Right, you need context for the tests.
Precisely. It ensures they're looking at your specific situation, not just treating a symptom in isolation. It guarantees that tailored approach right from the start.
Okay, so once they've really heard your story, got that foundation, then comes the next phase, right? The physical exam.
The hands-on part.
And this isn't just a general checkup. It's very focused, very targeted on your spine, the muscles around it, and how your nerves are functioning.
That's right.
So what does that actually look like? Well, they'll likely check for any muscle weakness. Maybe have you push against their hand or pull, things like that.
Standard neurological tests, yeah.
They'll test your reflexes, the knee-jerk thing, but maybe in your arms or ankles too, depending on your symptoms, checking those nerve pathways. And they'll carefully feel around, checking for specific tender spots, pinpointing exactly where it hurts when they press. Plus, they'll watch how you move, how you bend, maybe twist, how you walk, looking at your range of motion and movement patterns.
And it's really important to stress that these physical findings, they aren't just, going through the motions.
Not just a checklist.
No. Not at all. They are absolutely essential. They guide the next steps. They help the surgeon start narrowing down the possibilities. Like if they find a specific pattern, maybe a certain reflex is off, combined with weakness in one leg muscle, that can point directly towards a particular nerve root being pinched.
Ah, okay. So the physical clues confirm or add to the story you told them?
Exactly. Your body is sending signals, and the exam is how the surgeon reads those signals. It shapes their thinking about what diagnostics might be needed next.
Okay, here's where it gets, really interesting for a lot of people. After the story and the physical exam, then you get into imaging and maybe other tests.
Right, the deeper look inside.
Based on everything gathered so far, your narrative, what they found in the exam, the surgeon might then order specific tests to get a much clearer picture of what's actually going on internally.
Makes sense.
And Dr. Katsevman's insights mention several types you might come across. There's the MRI, of course, magnetic resonance imaging. That gives those really detailed pictures of soft tissues, discs, nerves, ligaments. Very common.
The gold standard for many spinal issues, yeah.
Then there are CT scans, computed tomography. Those are often better for looking at bone structures, so maybe checking for fractures or bone spurs.
Different tool for a different job.
Exactly. And he also mentioned something called a full-body EO scan, which sounds fancy.
It's a type of X-ray, but low dose.
Right, low-dose X-ray that creates a 3D image of your whole skeleton while you're standing up, so it helps assess your overall alignment, your posture.
Which can be really important for spine problems.
Yeah. And then there are dynamic X-rays. That's where they take pictures while you're actually bending forwards and backwards or standing to see how your spine moves under load.
See if there's instability.
Precisely.
Yeah.
And finally, if they suspect nerve issues, they might suggest an EMG, electromyography.
Nerve testing.
Yeah, it's not just a picture. It's a test that measures how well the electrical signals are traveling along your nerves and into your muscles.
So a whole battery of potential tools.
Definitely, which
Okay.
raises a key question.
What's the goal of all this testing?
Exactly. And Dr. Katsevman is very clear. The goal is to gather the most complete information possible before making any big decisions.
Right. No rushing.
It's about being thorough, looking at all the evidence, making sure you have the full picture before even thinking about treatment options.
It's that data-driven approach.
Yeah.
Build the case properly before deciding on the verdict, so to speak.
Yeah, I like that analogy. Now, this next point is huge, really vital, I think, and probably quite reassuring for many people listening.
Okay.
It's the conservative first approach.
Ah, yes. Very important.
Dr. Katzman strongly emphasizes, and this is for most patients, that surgery is not the first answer.
That's a critical message. It counters a lot of common fears.
Totally. It's a big piece of knowledge. So the focus, overwhelmingly, is on trying non-surgical options first. The insights detailed various types of conservative care they typically explore. Things like physical therapy, targeted exercises, stretches, maybe specific techniques like traction or decompression therapy to ease pressure on nerves.
PT is often incredibly effective.
Then there are medications. Could be nerve pain meds, maybe muscle relaxants if you have spasms, or anti-inflammatories to tackle swelling.
Standard tools in the toolkit.
And also injections. These can range quite a bit. You might hear about epidural steroid injections, putting anti-inflammatory medicine near the spinal nerves, or SI joint injections if the pain is lower down in that joint between the spine and pelvis.
Targeting the inflammation directly.
Right. And even things like nerve ablations, which is basically a procedure to kind of quiet down specific nerves that are sending pain signals.
Using heat or cold usually, yeah.
All aimed at reducing pain, improving function without needing surgery.
And here's the really powerful takeaway from Dr. Katsevman's work on this. He states clearly that most patients improve with conservative care alone.
Wow. Most patients.
Yes, that's a key finding. It really challenges that assumption that seeing a spine surgeon automatically means surgery is on the horizon.
Definitely flips that script.
It shows that effective non-surgical options are out there, they work for the majority, and they are absolutely prioritized.
Yes.
They exhaust those less invasive paths first. That's hugely empowering for patients to know.
Incredibly empowering. Knowing surgery isn't the default, which brings us perfectly to the next crucial stage, actually creating your personalized treatment plan.
Right. Putting it all together.
And the core belief here, coming straight from Dr. Katsevman, is that treatment should be a team decision.
Collaboration.
Yes. It's not the surgeon telling you what's going to happen. It's a genuine partnership between you and your doctor, maybe other members of the team too.
That's how it should be.
And absolutely central to this whole process are your personal goals, what you want to achieve. Those goals actively shape the discussion about treatment options.
It's not just about fixing the MRI image.
Exactly. Maybe you just want to, walk your dog without pain, or get back to gardening, or just sleep through the night.
Your quality of life goals.
Yeah. Your specific desires are what guide the conversation. The plan has to align with your life.
And it's important to highlight here, while those imaging results, the MRI, the CT scan, they're definitely part of the picture.
Sure, they're important.
Dr. Katsevman is clear that they don't drive the decision alone.
Ah, okay. Good point.
It reinforces that holistic view. Your overall condition, your symptoms, how much it's impacting you, and those personal goals we just talked about, they're paramount An MRI might show a disc bulge, but if you're functioning well without much pain,
Then surgery might not make sense.
exactly. The image is just one piece of a much bigger, much more personal story.
Okay, so when does surgery actually come into the picture?
Good question.
The insights lay out specific circumstances. Generally, it's reserved for people who haven't improved despite trying comprehensive conservative care. They've given PT, meds, maybe injections, a real shot, and it's just not working enough.
Right, when conservative options are exhausted.
Or, and this is critical, if someone has significant progressive neurological symptoms. Things like worsening weakness or numbness that's spreading or serious balance problems.
Things that suggest nerve damage is happening or could become permanent.
Yeah, indicating a more serious issue that conservative methods likely can't fix.
Makes sense.
And even when surgery is needed, Dr. Katsevman really emphasizes it's tailored specifically to you. It is absolutely not one size fits all.
Personalized surgery.
Yes, every surgical plan is unique, designed for that individual patient, considering their specific problem, their anatomy, their life goals.
And what's really fascinating, kind of the foundation of this whole philosophy, is how Dr. Katzman outlines 3 guiding principles. These really underpin the entire patient-centered approach.
Okay, what are they?
First is shared decision-making. We touched on this, but it's worth stressing. It's not just about informing you. It reinforces that you and the doctor actively work together on the plan.
So you're a real partner in the process.
You are an active, empowered participant, not just passively receiving care.
I like that. What's the second one?
The second principle is less is more.
Less is more. How so?
It means surgery is truly seen as a last resort. It should be done for the right reasons at the right time.
Okay.
So they only recommend surgery when it's genuinely the best path forward after other options have been properly explored. It's about being precise and necessary, not just rushing to operate.
Got it. Makes sense. And the third?
And the third principle, which I think speaks volumes, is that second opinions are actively encouraged.
Really? They encourage you to see someone else?
Yes. Dr. Katsevman actively supports patients getting a second opinion. He wants you to feel confident and informed about your choices. It means you can truly own your medical decisions, feel completely comfortable, have that peace of mind. It shows a real commitment to patient trust and autonomy.
That's actually amazing. It builds confidence just hearing that.
Done it.
So, okay, bringing this all together, what does it all mean for you, the listener?
The overall philosophy we get from Dr. Katzevman's approach seems crystal clear. You should expect a thoughtful, caring, really personalized experience. One that focuses on you, the individual, your unique story, your goals, not just, that picture on the MRI scan.
Right. Treating the person, not the image.
Exactly.
Yeah.
And crucially, everything should be explained in terms you can actually understand, empowering you every step of the way.
Which must be a huge relief.
Absolutely. For anyone facing that kind of appointment, knowing this is the approach, it provides a powerful foundation for feeling less anxious and more ready to engage in your own healing.
Well, so we've really walked through a comprehensive journey today, outlining what to expect during that first spine surgeon visit. We went from the importance of deeply listening to your story,
The foundation.
through the thorough physical exam, exploring those advanced diagnostics when needed,
Understanding the tools.
really emphasizing the priority given to conservative, non-surgical treatments first.
The less is more idea.
And finally, landing on how a truly personalized plan is crafted together based on shared decision-making.
And hopefully, what really comes through for you listening is the immense value, the necessity, really, of being an informed, active participant in your own healthcare. Those principles Dr. Katzevman highlights, shared decision-making, encouraging second opinions, they aren't just nice-to-haves.
No, they feel essential.
They fundamentally underscore the power you have through self-advocacy when you're navigating these complex medical situations. Your voice, your concerns, your goals, they truly matter.
Yeah.
They have to shape your care.
Absolutely. Which leads to a final thought for you to maybe mull over, thinking about this whole patient-centered model where your story, your goals, your active input are central, where second opinions are welcomed. Just consider, how could applying that kind of model transform your experience across all areas of your health and well-being?
Interesting question.
How much more empowered, how much more effective could you be in managing your health if you consistently aim to be an informed partner in every medical decision, rather than perhaps sometimes feeling like just a passive recipient of care?
It's a powerful perspective shift.
It really is. Something to think about, not just for spine health, but for your entire health journey.